Hi, so if you're worried about tapering, I've got a great video for you. We're going to be sharing the top 10 tips when it comes to tapering. And if you are someone who is worried about some of the horror stories that you've heard out there, you are going to want to listen to this because most of those can be avoided if you follow these 10 tips. Hi, I'm Dr. Josef Witt-Doerring. I'm a psychiatrist, and I've been working exclusively with tapering some of the most complicated patients off psychiatric medications for several years now. Let's get right into it. Tip number 1 is you want to stabilize first if possible. What does this look like? You want to make sure that you're not in a state of withdrawal. Now, this presents in 2 different ways. Usually, it presents after you drop down a dose of your medication, or maybe you've even gone cold turkey, and within the first week or so, you've developed a lot of really severe, uncomfortable symptoms. If that has been something that's happened to you and that resonates with your experience, you want to go up to that previous dose and hold there. But stabilization from withdrawal can happen in another way. And this is from interdose withdrawal. And this is really common with the benzodiazepine medications, things like Xanax, sometimes Klonopin. How this usually presents with people taking that on a daily basis is they'll start to get withdrawal symptoms right before their next dose. And so if that's you, you want to make sure you space your medications out evenly throughout the day so that those interdose withdrawal symptoms go away. So what this might look like is maybe you take Xanax extended release in the morning and you find that right before you take that dose the next morning, you're feeling really bad. So you would transition from the extended release version onto the instant release version, and you would take that same amount, if it's, let's say you're taking 1.5 milligrams extended release. I don't know if it comes as that, but let's say, for example, you would split that into a 0.5 milligram 3 times a day, and you would evenly space it out, and that should take care of the interdose withdrawal. The second most important thing that you should be doing afterwards is to make sure you're dropping stimulants. And the 2 main ones that I see are caffeine and nicotine. Essentially, all of the most difficult drugs to taper, I would say the benzodiazepine class and the antidepressant class, they seem to cause anxiety and sleep problems when people are coming off, and stimulating substances just make that worse. And so one of the first things that I always do with my clients is I make sure that they're, if they're chewing tobacco, they completely stop that. If they're using a lot of caffeine, I make sure they completely stop that. That will give you a much better place to taper from because you're not dealing with additional substances which are already contributing to anxiety and insomnia. Number 3 is that you want to taper in a specific priority list. What do I mean by that? So this is specifically for people who are on multiple drugs. If you're not on multiple drugs, this is less important. But if you are, the number one thing you want to look at when you're tapering someone is first, are they having a severe side effect from one of the drugs? Because if they are, you want to start there. Now, where I've seen this happening in my practice the most is with the antipsychotics causing something called akathisia, or a very chemical kind of type of agitation. Most of the people who want to come off their medications are doing so because they don't feel well. You need to make sure that you address one of the reasons they don't feel well, if that is this type of side effects. So you want to look at all of the medications, and if you're having one of these severe side effects, you want to start there. Now, I don't have time to go into the entire priority list, but I do cover this in the webinar for my course. And in that, we go through making sure you taper by primary drug effect, and then you taper by duration of use, and then by potential side effects of the drug. And if you're interested in looking at that webinar, it's going to be linked below. Tip number 4, your taper speed is going to be dictated by what you're trying to achieve because of a specific cause of your symptoms. And so what do I mean by this? Let's say you are having a toxic side effect reaction. Your taper speed is going to be much faster than if you're just doing an uncomplicated slow taper. 5 to 10% per month is generally what we recommend for someone who's doing an uncomplicated taper, who's not having drug side effects and things like that. We recommend they go down very smooth and slow like that. But sometimes we speed that up. Again, we fully go into this in the webinar for the course, which you can check out below. Tip number 5 is that when you are choosing a vehicle to taper from, and by vehicle, I mean compounded capsules from a pharmacy, tablets, or liquids, generally a liquid microtaper is going to be the best for the majority of people. This is because working with liquids allows you to do a lot. So it can allow you to microtaper because it's very precise. And microtapering is where instead of dropping the dose every 14 to 30 days, you'll drop the dose every day or every other day to come down very smoothly. Another good thing about a microtaper is that it's fairly low time intensive for the doctor that's working with you. So if your doctor can just send in a script to a compounding pharmacy or for a manufacturer's liquid, they can just leave that on repeat. You can keep on picking it up. You can adjust your dose as you see fit, according to your symptoms. And so that works really well. It's also not that expensive when you compare it to doing compounded tapers. The last thing that's really neat about liquid microtapers is you can do blind tapers really easily. Blind tapering is essentially where you enlist the help of a family member to dose you, but you don't actually know what the dose is. Obviously, you give them a plan and there's parameters and they know that you're kind of coming down at that very smooth rate. You have them dose you so you don't anticipate the drops, because sometimes that can be very anxiety provoking. When you're using syringes to administer the medications, it's really easy for someone to just administer it straight into your mouth without you noticing what's on the side of the syringe. Or they can even just put little like stickers and labels over them, and they can leave a bunch of them in the fridge for you. And so that's much easier to do a blind taper with liquids and syringes. Number 6 is don't overwhelm your doctor. I see a lot of people who go into their doctor's office and they come with, big stacks of papers saying, I have protracted withdrawal injury, the psychiatric institution is corrupt, things have really gone very bad. And, you may feel these things, and a lot of these things may be true, and you may be very upset about it. But at the end of the day, what are we trying to accomplish? We're trying to enlist the help of someone in helping us come off. These providers, they may never have heard about protracted withdrawal injury or tapering. People get kind of frozen, when you throw too much stuff at them. So you want to make tapering as easy as possible. Take some time to figure out a plan that you want to initiate, and then just bring them the plan. Hey doc, I've been on Xanax for a long time. I've been thinking about coming off. I actually tried this once before and it didn't work. I'd really like to do this with a liquid. And oh, by the way, I found this liquid manufacturer. I think, I'd just like to get 30 milliliters of Xanax. I'm going to replace, my tablet with this dose. I'm just going to lower it down. Is that okay with you? That is a lot easier of a sell than trying to teach them what protracted withdrawal injury is and then trying to get them to go through the process with you. If you could just kind of dish them up a plan like that and they just go, oh, that's easy, no worries, that's simple, then it's going to be a lot easier to work with them. Number 7, you want to track your symptoms. Tracking your symptoms is really important because everything with a taper has to do with knowing when to make adjustments. This will completely determine the speed that you're able to go at. So for instance, if you start your taper at a certain speed and you're not developing a lot of symptoms, you might even be able to bump it up a little bit. So you could actually speed it up. However, if you are kind of tapering and your symptoms are kind of building, you don't want to push through that. You want to slow it down. Now this, in theory, sounds really easy to do without tracking. You just say, hey, I'm going to listen to my body. But what I've seen in practice is that people get lost all the time. They start looking back and saying, well, how was I feeling 2 months ago? Like, am I heading in the right direction? And they lose track of their baseline because tapering can be a state of, I would say, a lot of anxiety and panic sometimes. And we don't make our clearest decisions when we're in these panic states. But what I find very helpful for people is if they have an Excel sheet where they're tracking their symptoms kind of day by day, they can see the patterns. They can say, oh, wow, look at this. My symptoms have gradually been building over the last 3 weeks. I think I'm going too fast. I'm going to hold. I'm just going to watch. I'm going to see it go back down. And then I'm going to adjust my speed and see if that's the right speed and move on. So tracking it just makes things a whole lot simpler and easier in the long run. It gives you a lot of confidence that you know what your baseline is and what your body's doing with the taper speed. Tip number 8 is that you should expect things to be a little rocky if you have a protracted withdrawal injury. A lot of the people I work with, they have this type of injury, and one of the hardest things about it is that the symptoms kind of go up and down. They don't sort of stay the same every day. They could feel less symptoms for a period of 2 months, and then they could feel more symptoms for a period of 2 months. And this can be really frustrating because sometimes you worry that you're tapering too quickly. If you're doing a taper with protracted withdrawal injury, then sometimes it can be easy to get lost. And so again, this goes back to the importance of tracking your symptoms. Because once you start to track your symptoms, you're going to start to be aware of what your body is doing with this protracted withdrawal injury. And you'll say, okay, well, I seem to have these waves of symptoms. They're happening every 2 to 3 months. They last for about a week, and that's normal. And just knowing that over time is very reassuring, because when things kind of build up, you don't start questioning, oh my God, am I going too fast? You say, okay, this is very normal for me. This has happened last time. You can just hold your taper steady, and you could say, hey, this is par for the course. I have a protracted withdrawal injury, and this too shall pass. Tip number 9, it is not a race. Why I bring this one up is it's because something I see a lot is people really eager to stop their taper. They've been doing it for a while, and then they just jump off at the end. They jump off when they're on the last milligram or 2 milligrams. And that is probably the easiest way to mess up your taper. Things get the hardest right at the very end. So right when you're kind of getting to that last milligram or couple milligrams, that's when you want to be especially careful with your taper, really kind of coming down smoothly, because those steps right at the end of the taper seem to hit people the hardest with withdrawal symptoms, and they are the most high-risk periods for developing protracted withdrawal injury. So do not rush the end of your taper. And finally, tip number 10, when you're doing one of these tapers, you want to make sure you live as normally as possible. And the reason I say this is because tapering can suck. It can feel bad, and distraction is what will help the days go by. So you always want to have an attitude of slightly leaning into things that you don't want to do during a taper. If there's a family gathering and you're just like, I'm really just not feeling up for it, or if there's some kind of activity that's social, things that you used to normally enjoy, just try it. Try it a couple times and see what it's like, because you might just be surprised, and you may go there and say, I thought I was going to hate this, but you know what? I was there for 90 minutes and I was distracted. It was easy to get through. Don't wait to live your life until this is over. I try and live as much of it as you can while you're going through it, because it will make the taper go faster. A lot of times it'll actually make you less depressed and anxious. A lot of people feel depression and anxiety totally independent from their taper symptoms when they're going through this, because sometimes they stop working, sometimes they don't socialize, sometimes they don't exercise, and they lose all of these things. So to the extent possible, keep those things in your life that used to bring you happiness, and they may very well just do a little bit of that while you're going through the withdrawal. Okay, so I hope you enjoyed that. Those are just the top 10 tips. Obviously, there is a lot more when it comes to doing a really good taper. If you're interested in learning more about how to execute the perfect taper to get you off your medications, I'd recommend that you come and you check out our course. We've got links below this video.